I'm Kelly Schermerhorn, Public Information Officer for Catawba County Public Health, and I'm here with Susan Moser, an intake nurse for our adult health clinic. And first of all, we'd like to wish everyone a Happy New Year and remind people that this month in January we're celebrating Cervical Health Awareness Month. And with that said, we're going to share a couple easy steps for everyone to raise their awareness about cervical health, and also maybe just some steps that in general will help you get to a healthier place. So our number one step is to get informed. So Susan, what can you tell us about getting informed on the subject of cervical health?
Well, educating yourself is the most important tool in maintaining your health. Each year, 11,000 women are diagnosed with cervical cancer, and of that, unfortunately, 4,000 women die a year from cervical cancer. The good news is that cervical cancer is nearly 100% preventable and curable if it's caught in time.
That's good to know. I think one of the key factors that stuck out for me is that you said that it's 100% preventable. So that's a key takeaway. What might be some of the risk factors associated with cervical health?
One of the most important risk factors, is being exposed to HPV virus or human papilloma virus. This is a common sexually transmitted infection. However, now there's an immunization available, an HPV vaccine, and if that is given prior to exposure, it is protective against most of the high-risk types of cervical cancer. Okay. Also, women are at increased risk for cervical cancer when they have multiple sex partners or they began having sex at an early age. One of the other more important factors is that it's long been known that women who smoke tend to have a higher rate of cervical cancer than non-smoking women.
Okay. I think these are really fairly common factors that you're talking about that people may have. So if someone has identified that they have one of these risk factors, would they know if they have cervical cancer by any symptoms?
Mm-hmm. Unfortunately not. Most of the time there are no symptoms from cervical cancer until it's invaded into other tissue. At that time, there might be problems with abnormal vaginal bleeding, and that might be bleeding after sex or during sex or bleeding after menopause. They might notice a change in their discharge, vaginal discharge, but unfortunately those symptoms can be caused by a lot of other different reasons, like a simple vaginal infection. So anything that goes on, any symptoms like that, you need to be checked and have an exam done.
Okay. So then obviously, again, the key factor to take away from what you just said is that there are symptoms, but there are no telltale symptoms of cervical cancer. So then one of the most important things would be prevention. As we already said, it's 100% preventable. And that's why our number two step for today is getting a PAP. What kind of important things do we need to know about getting a PAP?
Absolutely. One of the most important things is that women maintain, having a PAP done. And usually that's every 2 years, 2 to 3 years. The clinician would help you decide when you need to have a PAP done. But what's the most important thing is, if you've ever had an abnormal pap smear in the past, if for some reason you failed to follow up, then you definitely need to be somebody who has another pap smear done. We also here at the health department are participants in the breast and cervical cancer prevention program, which is called the BCEP program. And for women who are eligible, we do breast and cervical screening.
Okay, great. And did you mention, is there an age limit for that program?
It's 40 or older. 40 and
older, okay. And if a woman, it's great to know that program is available, of course, for women 40 or over, and especially if there's financial assistance. But what about women who are younger than 40? When's the appropriate time to start getting a PAP test?
Right now, the American Cancer Society recommends that women start their PAPs 3 years after they've become sexually active, or by age 21, and that's always important to follow. And especially for younger women, that is the way that we might find out that they have cervical cancer or precancerous. So it's always important that they continue or follow with their screenings.
Okay. I appreciate the fact that you touched on the importance of getting a PAP test, especially for those women who are younger, because our number 3 step for today is to make a plan. Whether that plan is getting a vaccine, like you mentioned earlier, or whether or not it's simply marking your calendar to have an annual PAP, or every 2 to 3 years you put it on your calendar. And of course, the best way to find that out is to call your physician or even our health department. So that's very valuable information, and I appreciate it. So then, just to recap today, we reminded you of 3 easy steps that you can take to one, raise your awareness about cervical health, and also just to some steps that you can remind you of general health practices. So those were, number 1, get informed, number 2, get a pap test, and number 3, make a plan. And if you want to get started on those today, you can call the Catawba County Public Health Department, and you can speak to someone in our adult health clinic or another nurse, and the number is 828-695-4445.
And that's our appointment line for our appointments. But if you have any questions, just ask to speak to one of the nurses. We'd be glad to talk to you.
Okay. Well, thank you, Susan, for being with us today.
Thank you.